que tout le monde est prêt?
Ouais.
Merci.
Ouais, c'est bon? Ouais. Ils sont prêts, là. Bonjour à tous, bienvenue.
Hello, everyone, and welcome to this press conference to go over the COVID-19 situation in Quebec. The Premier of Quebec, Mr. François Legault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, the National Director of Public Health of Quebec, Dr. Horacio Ruda, and the Regional Director of Public Health in Montreal, Dr. Mylène Drouin. Mr. Premier. Yes, hello, everyone. So I wish to salute, of course, the Minister of Health, the National Director of Public Health of Quebec, and Dr. Drouin, responsible for the Montreal Public Health. I also wish to salute the Minister of the Metropolis, Chantal Rouleau, and say that she is the one who is responsible to make sure that we give all services, because, of course, a lot of ministries are involved. So I asked her to coordinate all necessary services to be able to help, particularly the MMC, to be able to get through this crisis. Before the daily numbers, I wish to come back to everything having to do with the masks. As you've seen, we are strongly recommending their use. I wish to be quite clear with Quebecers and in particular with the MMC, taking into account the scope of the pandemic. I wish to repeat that it is very important and we very strongly recommend that everybody who uses public transportation, buses and metros in the MMC to wear the mask. We also wish, and I want to be clear with this, we know that there are neighbourhoods that are hot zones, some more than others. In Montreal and Laval, it is even more important in those sectors that everybody wear a mask. And to help out, and after having discussed it with Mayor Valérie Plante, I'm happy to announce that we're going to be giving 1 million masks to the Mayor of Montreal, to the City of Montreal, and we will be giving $6 million to all transportation corporations in the MMC, the purpose of which will be to distribute to people who, for all sorts of reasons, cannot make or get their own mask. We will make them available. That will, of course, take a few days before the masks be at the entrances to metros or buses, but at least with this 1 million masks and with the money that we'll be transferring to municipalities and public corporations, we believe that we'll be able to, over the upcoming days, to freely give masks to those who don't have any. And I'd like to repeat, particularly in public transportation, particularly in hot zones, it is important to wear the mask. The day's numbers: 50 new deaths, a total of 3,401. I offer my condolences to all families and loved ones of the 50 victims. We now have 41,420 confirmed cases, an increase of 796. It is important, however, to remember that out of those 41,000 cases, there's at least 11,000 that we tested negative and who are cured. We haven't tested everybody, but there's at least 11,000 who are cured. In hospitals, we had 1,822 people who were hospitalized. That is a decrease of 13. In ICU, we had 191 people, which is an increase of 1. So it is important to see the trends. We can't just look at the numbers for one day, but we can still see that there is some good news. First, the number of deaths. When I saw 50 this morning, of course, we can't base ourselves on just one day's numbers, but let's say that it's been a while that we haven't seen such a low number. Number of cases, too, despite the increase in the number of testing, we are below 700, and it's been a while that we hadn't seen that yet. And the hospitalizations, once again, we have to look at them as a trend. We can say that for a certain time, we've seen a downward trend. Concerning the tests, we are testing all employees of CHSLDs, both public and private, systematically, even those employees that are asymptomatic. And Dr. Drouin was telling me this morning that she reached her objectives, 3,000 tests in the community. So happy to see that things are going well in Montreal. To Dr. Drouin, I'd like to come back to my meeting from yesterday with the CEOs, managers of the CHSLDs of the Greater Montreal area. Certain number of conclusions. The first, and it was to be expected, the great challenge that we have is staffing. Drawing more orderlies, nurses, workers within the health network, particularly in CHSLDs. There are many ways, of course, of drawing people. There are wages, and as you were able to see, we set up temporary premiums, and as I've often repeated it, we are hoping to get to an agreement with the union so that these premiums become permanent, so that it be more attractive, for example, than that an orderly, rather than starting at 21, they start at $25 an hour. I mean, it is important. But it's not just a question of wages, because we are in a situation where we're taking into account that there's a lack of employees. That means that the employees that are there have to work that much harder. And I want to take advantage once again to thank them. But our society has to put more value on those people. And I have a message. I remember when I was a teenager and I saw it with my boys. We don't know what we want to become when we're older. I would tell young people, look at the possibility of training and to go work in the health network. You know, in life, it's important that what we do is something that is valorizing. And it seems to me that taking care of other people, caring for people who are more vulnerable, who are older, who are ill, it's something that does give us value. So I'm call out to the young people and all those who have lost their jobs as well, perhaps in sectors where it might be more difficult to get them. Do consider getting trained, because it is gratifying. And of course, we do need people, and with the population that is becoming older, it will be even more true in the health network. So I'd like to get back to my meeting with the managers of the health centers. It is true that, first, we have been going through a scarcity of staff for years, and also we don't have enough qualified staff. You've seen it during the crisis. We asked people to go and register on Je Contribue, even if they had no qualifications. So, of course, when comes the time to apply procedures to minimize the risks of infecting residents, well, it is more difficult when there are people who don't have all the qualifications. So that is very important if we wish to change things, to have more qualified people in our networks. In the problems that were raised, because what I was asking to the chair people of the health centers, but also the CHSLDs, you know, what happened, what has to be changed in the future. Right now, there are some CHSLDs that don't really have a boss for all sorts of reasons. In the past years, there's been restrictions with the budget, and I don't mean to be criticizing this. The idea is to say it's important that there be a boss per establishment. I can't imagine that somebody is responsible for many different facilities or establishments. There's a team spirit, and when we want to make sure that the guidelines are followed, it is important that there be a boss. The other thing that was said to us as well is that the entire staff that does infection prevention work, when there's no pandemic and that we're forced to set up certain budget restrictions, it's tempting to say, well, the people who do prevention of infection kind of work, there are positions that were abolished over the past few years. And now we realize that these positions are important, even if we see that it's not as useful when there's no pandemic. It is still important that these positions be reinstated. The other subject that we talked about and that we had already talked about here is everything having to do with private CHSLDs. Of course, CIUS or CIS CEO, when there's a public CHSLD, is their employees, so it is easier to set up guidelines. But when it is managed by the private sector, yes, we can make inspections, and yes, we can ask for people to be accountable, but it's not as easy. So I'm going to repeat what I've already said. We are not excluding the possibility in the reform that we are preparing right now that all CHSLDs and centers where there's a lot of care given, where we need doctors and nurses and orderlies who are trained, that it all become public. I heard many of the managers say last night, yes, these are living environments, but they are also care environments, just as important as hospitals. So our hospitals are public. I think that we have to seriously ask ourselves the question, should all of our CHSLDs also not all be public? And I don't want to, I don't mean to be criticizing the private managers. Some are doing very good work, but it's just that when things aren't going well, except, without taking the steps of guardianship, it's really hard for us to intervene. Another thing that was said to us, and I knew that, is that we have a lot of places that are obsolete, dilapidated. We still have residences where there's 2 residents per room. Obviously, that is not something that is to be wished. And in our homes for the elderly that are going to be replacing our CHSLDs, it's already planned that there's only going to be 1 person per room, that the rooms will be bigger. Of course, we can't just say we're going to wait for all homes for the elderly replace these CHSLDs. There's going to have to be a lot of renovation work to be done in our CHSLDs right now. Yesterday, you saw the president of the Treasury Council who made sure that a lot of the work that was supposed to be done in elderly homes and CHSLDs was going to be done earlier. And we're going to work on that very hard, and that is a commitment that I am making. I am personally making myself accountable to that because a lot of Quebecers are not proud of what happened in CHSLDs, me first. So I want to make sure over the next few months, of course, we're not going to succeed doing it in just a few months, including having homes for the elderly for everyone and having the trained staff for everyone. But we have to be able to go towards that as quickly as possible, and I am personally committing to this. I would like to end with my daily thanks. My daily thanks are for parents, families. It is the International Day of Families. I can imagine, I'm a parent, I can imagine that having children at home 7 days per week for 2 months, we love our children, but it can be demanding. And I do remember my 2 boys as they were teenagers, let's say that they're not always docile, to use a word that we have used in the past few weeks. So bravo to the parents, and thank you for your patience. And I know that in Montreal and in high schools, there's a lot of weeks ahead of us before we will be seeing them go back to school. But without wanting to make things worse, a lot of parents have sent me emails. They were very happy of the back to school of their child. Not that I wanted to rub salt in your wounds. I will continue repeating the same thing. The virus is not going to disappear in the next months, perhaps not even in the next years. We have to get used to these new guidelines and of wearing a mask. We have to get used to always staying 2 meters away from other places, other people. We have to get used to washing our hands with soap regularly. I know it's not easy, but at the same time, I trust that Quebecers are able to adjust themselves and of winning that fight against the virus. I count on you all. Thank you.
A few words in English. Good afternoon. First, I want to talk again about the mask. We strongly recommend that all people wear a mask in buses, metro, all collective transportation, and in hot zones also, where you have in the community many people infected. It's even more important to wear the mask. So to help everybody having a mask, I announced today that we're giving 1 million masks to the city of Montreal, and we're giving $6 million to the different transportation society, like the STM, the STL, to provide free masks to people who don't have masks. So I think it will help to start in the right direction. Of course, all people who can make their own mask, I invite you to do so. So if we want to return to a normal life, it's very important that we follow our 3 rules. We keep our distances, we wear a mask, and we wash our hands with soap when we come back home or where you work. So I'm counting on you all. Thank you.
On va débuter la période de questions. Il y a des micros prévus à cet effet. Je vous demanderai s'il vous plaît de vous limiter à une question par journaliste.
We will now start with the question period.
Oui, Philippe Bonneville, Cogeco.
Monsieur Legault, vous avez dit récemment...
You said recently that you could not make mask wearing mandatory in the metro because there weren't enough masks, that we weren't able to distribute them and all that. Now, 1 million masks are being announced. We know that in the Montreal metro right now, we're not 500,000, users per day. We're at about 10% of that, 50,000. Now that we had that 1 million masks and that the distribution will be made at the entrance to the stations, what is now preventing you from making wearing the mask mandatory in the metro? Well, first, I'm not excluding that. I want to be very clear. I would much prefer that people respect the guidelines, as was done for the other guidelines that we announced since the beginning of the crisis. And yes, it will take a certain number of days before masks get to the door of every metro or bus. So I want to know how things will happen. I also want to know whether people wear it or not. I mean, it's useless to make something mandatory if already it's done as a practice without making it mandatory. So I'm not excluding it, but we will be following the situation over the next few days. You talked about the lack of employees in the health network. We know that many got infected by COVID-19. Those who continue working right now, can they expect to have their vacation canceled over the summer? First, that's not the objective. The objective is not to cancel anybody's vacation. But at the same time, if we're missing so many employees, we can't start confirming weeks off in the upcoming weeks. I have very good hopes, and I've said it, I have very good hopes that over the next few weeks, we will have a few thousand employees who will be coming back from their quarantine, and that will allow those employees who are still there to take vacation time. And it is not our intention to, prevent people from taking vacation. But are you excluding it? We're not there right now. We're just trying to be careful while we're in this crisis, while things are not under control. But I hope that over the following weeks that we'll manage to take control back, and then we'll be able to give vacation. There are are discussions being held right now with unions, and as the Premier said, our intention is to give vacations to people. So it's not going to be like in the past summers. However, don't expect that. But we are hoping and we believe that we'll be able to give a minimum vacation time, and the unions are aware right now of the plan that we are drafting. And I believe that the objective is quite clear. It is to give vacation time to as much as possible. So important work from parents. I wish to congratulate my wife, who's working full-time at home, teaching and working. So what are you waiting for what are you expecting, rather, for remote teaching? What are you expecting from teachers? Yeah, it almost like a question that I asked myself. First, we expect that teachers offer complete work. And then we also expect a very tight follow-up on the part of teachers with the children. We also expect that there be a crescendo over the following weeks. It is important to say it, and I repeat it, the school year is not over, even though the schools in Montreal will not be opening until the month of September. The school year is not yet over. So there will be a report card that is going to be supplied. And of course, there's going to be part of it that is going to be judgment. But some children are going to get to the next level and some others not. So already there's 60 to 65% of the school year that had taken place. So that, of course, will be used as a base to be able to conduct that evaluation. Homework, pods. There are the Télé-Québec shows, telephone conversations or email communications between teachers and the children, and virtual meetings. Of course it's not ideal. And I said it yesterday and I'm repeating it. My choice, and I think that for the good of children, it would have been to reopen the schools, but taking into account the constraints that we are working under, I was going to say because of public health, but not because of public health. I understand very well the reasons why public health has arrived at that conclusion, but taking into account the constraints that we're working under, I think that it is important that we get the collaboration of parents when they can help, and that the teachers, there's 20-25% of the children who have learning difficulties. Dyslexia, attention deficit, autism, etc. And the teachers know those children. So we're asking the teachers to pay attention specifically to that 20 or 25% of children. Hello, Mr. Premier. You made a call out to young people for them to take the road toward healthcare facilities, but we know that in Montreal, it's like a slaughterhouse. There are hot spots where healthcare workers have become important vectors in the spread of the virus. Calling those young people, taking into account the present portrait, is that not telling them you are going to be cannon fodder? No, not at all. First, we have protective material in sufficient quantities. When the material in the individual protective material is used correctly, there's no risk for the employee. We, of course, also hope that this pandemic is going to become under control, but it is clear that in a society where the number of people getting older, the needs in the health network is going to be on the increase. So it has to be a profession that is given more value, both financially, particularly, the starting wages, that they be higher, but as a society as well, we have to also find the way of saying that this profession has value. We've been saying it since, we've been trying to say it since the beginning, speaking of about our guardian angels, but we realize more and more the important role that these people play in our society. So it's quite the challenge that we have ahead of us. Yeah, we have to promote it. So can we use advertisement? Can we, of course, the fact that we look at increasing the wages permanently, it will help to also have these this, be known. A lot of people know what a nurse is, but a lot of people don't know what an orderly does. So there's a lot of ways. But I think that we have to, as a society, we have to go towards that and know that it is beautiful, it is gratifying to take care of people who are ill and who need help. It seems to me that when you look at yourself in the mirror when you come home after work at night, you can be proud of yourself, and explaining it so that it's better known, and that's what I'm doing right now. It was briefly touched upon yesterday of palliative measures for children and families, and today there's the Association of Pediatricians. These people will say that they're very worried. We're going to need quick measures to help out the children. Could there be day camps this summer? For example, could we give help with food during those day camps? What measures could be set up quickly to help the families? Do you have any examples? Well, I named a few earlier on, but I'd like to come back to what I was saying. First, there's a message that is clear. The school year is not over. That means that until the 20th of June, I expect that teachers will be working, as well as the children, that there will be homework, that they will be studying, and to have the collaboration of parents to make sure of that. There will be a report card at the end of all this as well. So we have to be clear, this is not vacation until the 20th of June. So there are shows as well. We already set up shows on Télé-Québec. There are video pods that are being produced. Some are already available. We're going to be adding some more. So I agree with the pediatricians. It breaks my heart to know that there are children who won't be going back to school before the month of September. But at the same time, we have to do with the means that we have at hand. And I think that teachers have a responsibility, parents have a responsibility in order to minimize the damages to those children.
Bonjour, Monsieur Legault. Comment allez-vous?
How are you, Monsieur Legault? That's not my question, but I'll ask it anyway. I'm well and very well. We've had information saying that in certain hospital settings, some people who had the right to have the 8% premium got 4% instead on one pay, and 4% the following week, with managers saying that is your 8%. You know as well as I do that that's a 4% increase, not 8%. Others said that the premiums for full-timers in hot zones are completely bypassed by moving somebody around to a cold zone on the 5th day to avoid paying them. The question I'm wondering is, what can you do so that not only your guidelines are followed, but the intention behind them, because it is being intercepted? And also, I know that Ms. McCann spoke of the end of the Omerta, but employees are still not talking to us. Is it possible to decree an amnesty so that when employees speak to us, because very often, I've heard all of the press conferences since the very beginning, you get information from us because people talk to us, and it somehow does not get through the network. Okay, I want to be very clear, and you know me. I'm a pretty direct person. I'm going to be careful how I say this, but keep in mind that we are bargaining right now. We are bargaining with the unions. A manager, because what you're reporting is that there would be a manager who would have, after 30 hours in a hot zone, would have transferred the person to a cold zone to make sure that they don't get their premium? What would be the advantage for the manager to do that? Quebec is who pays the premiums, not the manager. And it's not even the establishment or the CIS that takes that out of their own pocket. So try to explain to me why a manager would manipulate things so crookedly to not give a premium to an employee. I don't see any. If it did take place, I would like for the union to give us the name of that manager, and if necessary, I will speak to that manager. The premium that we put here is to encourage employees, and the premiums we want to give them, they are financed by the government of Quebec. And managers, it's not coming out of their pockets, and there is no question of doing anything to not give premiums to anybody. So the unions that say that it's happening, I want to have names, and I want to go check. And if it is the case, I can guarantee that I'm going to be taking the means with that manager. The other thing as well that I would like to say is that it is absolutely forbidden having an employee who goes from a hot zone to a cold zone as much as possible. It is not a practice that we approve of. That's why we're talking about dedicated teams. So if on top of that, to avoid the premium, of course, it is absolutely not what is supposed to be done in a practice in infection prevention. And on top of that, of course, as the Premier has said, I also want to know where that's happening, because I want to make a reminder as far as the practices of infection prevention is concerned. Now, what I wish to say about the dialogue and the communication that we must have with employees, well, there's already union instances that take care of certain aspects like labor relations, but we will soon be announcing to you another modality that we're going to be setting up to favor the fact that employees who, for all sorts of reasons, did not have the possibility of transmitting their concerns for all sorts of reasons, because generally speaking, things go well, but there are places where there's still problems. And we will be announcing to you a strategy that we'll be setting up to absolutely get these comments. Inaudible question, answer, yes.
Pour Intexto Journal Nous, qui est un journal de la communauté haïtienne et des communautés culturelles de manière générale. Ma question s'adresse.
My question is for Mr. Legault. This week, the independent member of the National Assembly, Catherine Fournier, presented a motion at the National Assembly to ask that the National Assembly recognize the work of asylum seekers who are at the front against the war against COVID-19, as Orleans or other who are endangering their lives. And your parliamentary leader, Mr. Legault, rejected the motion, which means that it was not able to go through. First, I would like to know, is that your position? What is your position of your party, the CAQ? And second, if it is the case, how do you support that? Let's start by talking, generally speaking, of asylum seekers. We talked at length over the past year of all those who arrived through Chemin Roxane. In the case of this pandemic, even Mr. Trudeau does not wish that asylum seekers come in. And Chemin Roxane has been closed, the border has been closed. And last night we talked with Mr. Trudeau. We are going to be advancing that by another month. That's one thing. That doesn't mean that within those asylum seekers, including the members of the Haitian community, that there aren't good people that came to work in our CHSLDs. These are two separate files. And we have two members of the Haitian community in our ministers' board. And I am conscious of the problem of the Haitian community in certain areas of Montreal, and that is why we're giving 1 million masks, amongst other reasons, to Valérie Plante, so that she can distribute them freely in those neighborhoods where things are more difficult. So I think that we have to separate both of those. Asylum seekers is one thing. Taking care of the Haitian community, you know, and Lionel Carman is a very long-term friend. Yes, Dr. Carman. Lionel is somebody who has done a lot for Haiti, and Haitians are our cousins. Let's not mix things up, you know? Refugees going through Roxane, that's one thing. Let's not mix it up with the Haitian community. Well, that doesn't answer my question. Do you support the position of Mr. Estimon? What I understand from your question is that what was being asked was to support the arrival of asylum seekers. Yes. Well, neither the government of Quebec nor Canada are supporting that right now in the framework of the pandemic, so I don't support it more than the federal government does.
Buenas tardes, en español. Bonjour. Merci beaucoup.
I'll ask my question in Spanish. That was a joke. I represent the Latin American community today. As an immigrant, Quebec receives us with open arms, and we're proud of that. So I would like please, Mr. Minister, that you send a message to the Latin American community, since I suppose that you need us as well during this hard time. And, well, unfortunately, I don't speak Spanish or Portuguese, although I have a brother-in-law who is Portuguese. Maybe Mr. Rude, I can say something in Portuguese, but anyway, I'm so proud, and I know that there are a lot of orderlies who come from Latin American communities. And right now, they are experiencing a situation that it has been very difficult for the past 2 months, and I don't have enough words to thank them for what they're doing to help our elderly in CHSLDs, amongst other places. So thank you, gracias, everything. Thank you. Well, I could speak Portuguese to the Montreal community. I wish to say to everyone that we are very happy that the community has accepted taking care of people in our public sectors, as well as working in our health sector. Thank you so much for all the work that you have been doing. Can I just add something? And I won't speak Spanish, although I can say a few sentences because I don't want it to be... Right now, I'm talking... with all the operations that we're conducting in Montreal, clearly have operations that are going to be held in the hot zones with the mobile units, with the community groups. And the population, sometimes you will be hearing, different languages, guidelines given in different languages, saying that the truck is coming to test, and we are trying to come into contact with the leaders of those communities. We need you so that those messages can get to everyone and that they are understood correctly. So for me, it's always been the richness of Montreal to have you, to have that diversity throughout our culture. And I think that we must work together in the next weeks and months because we need doing it together, so that the messages be understood, but also so that we be able to respond to the different issues that are being experienced in different issues. Thank you very much. I represent the Latin American radios, and we are there as well. Please write to me. I will do so. Before going to the English questions, perhaps one last question in French. Hello to all four of you. My question is for Mr. Legault and Ms. McCann. There are 200 investigators of Public Health of Montreal to do contact tracing of infected people in the health network to stop the spread. Is there any question of increasing the resources because we know that things are hard there? Madame Drouin, are you going to increase the network? Or are we going to wait for the next pandemic before increasing the budgets for public health? Mr. Legault, you mentioned it. In terms of prevention, they've been pretty stable since 2013. So I could answer one part of it, but I can also, I can announce budgets if you want. No, just kidding. So right now we have a brigade or a team of investigation of 430 people, but it represents, as you said, about 230 equivalent full-time people. Our short-term objective is to recruit, and we have new ones coming, but we want to stabilize those teams because we cannot function with people who only have like 1 day a week to give us. There's an expertise to develop. And as I was saying yesterday, we're also working with an external firm so that the part that is more of, collecting information, more administrative stuff, can be done by a call center of sorts, as we know, so that we can put the public health teams really on the management of outbreaks and the other clinical part of the case analysis. So we really are in that movement, but our objective is to stabilize things. And of course, well, with the budgets, I'm going to let you answer. But since 2013, it's not stable. On the contrary, in 2015, public health was cut by 30%. Well, concerning the budgets, I think that up until now, what was asked by public health to be able to do the follow-up on tests, I think that unless I'm mistaken, it has been granted. Now, what I was talking about earlier on, it's another subject, is the prevention of infections in establishments. There were also cuts there, and I think that we are going to have to and from what I've understood from the managers yesterday, is that we're going to have to look at adding resources in those establishments for infection prevention. English now.
Global News, Mr. Premier, we're just wondering why the new numbers that we're getting from the government concerning the ill and infected people are different from some of the numbers that we're getting from the CS West de l'Île.
Why the data is different?
Yes, why?
There is actually, I would say, a look of every, even high, we are looking at the differences that can come from different reports. There is different sources of data. Ones which are manual, ones that were with different systems, even the ones measuring the deaths, there is 2-3 systems who can do it, and we sometimes have some differences. So we are investigating that thing to make sure things are okay. That's the same issue also with, I would say, the table about CCSLDs and that we had before, red, yellow, and there was some data that was not fitting well. So, and I can tell you that the Prime Minister is asking us every morning, where is the data? And we are actually making sure the one we're going to put is going to be the right one. We didn't have any command from the Prime Minister or anybody to don't show the data. It's just because we have problems with getting it in the right place.
Yeah, and maybe I would add that what I understood sometime is that when you look at the number of cases, you have the one that have been confirmed since the beginning and the one that are still active. So sometimes that explains the difference, but maybe there are other reasons.
It's a part of this, and in relation with budgets, I can tell you that as the Directeur National de Santé Publique, I'm going to be pushing for making more money in prevention, I would say not only in infectious control, but also for the obesity and all kinds of things. My Prime Minister, I just want to tell you that you will, and my Premier, I should say, because that's the right term, I think I should say, I will be there around you, and the public health too. But thanks for everything. Actually, the money is no object for doing our job. I can tell you the most big issue is to have human resources.
On va prendre la prochaine question.
Anthony Nerestan from CBC. Mr. Premier, what does the government know about the number of members of the armed forces that are sick, that have contracted COVID-19, and as far as which facilities are affected, and what the government plans to do if this happens more and more of the members of the armed forces start to fall ill?
In fact, I don't have precise information. What I have as information, that was a low number of people who get sick. I had this information by the press as you did. I will probably have to detect what is going on. From what I know, the people are evolving well. They probably had a test, but I don't have this information right now. I don't know if you had it, Mylène.
No,
so
I don't have this
we will look at, because as they are from the army, they are under the federal government. If they need care, we will treat them and everything, but I don't have the specific data.
And any plan in terms of what happens if more of them start to fall ill? What does your government plan to do?
About what?
If more of them get sick, what are your contingency plans?
I hope it won't happen. And as you may know, we never answer hypothetical questions.
On va prendre la prochaine question.
Merci. Giuseppe Valiante, the Canadian Press. I think this question is better targeted towards Dr. Arruda and Dr. Drouin. You had just mentioned there's 230 people working full-time doing contact tracing in the Montreal area. And if I'm not mistaken, I read about some sort of an email technology. Our firm is introducing that. But I'm interested to know where you both are at in terms of the technology on like an application that people can download on their phones. There was a little bit of mention to that a few weeks ago. So what I'd like to know is Quebec planning on introducing an application that citizens can download onto their phone that can do contact tracing, whether it's through Bluetooth or GPS? Is it through Bluetooth or GPS? And if you are planning on introducing something like that, what will you do to ensure enough people download that so it's effective?
Est-ce que tu veux répondre?
You can go and I will...
But I have a meeting, I think it's at the beginning of the week, to look at with specialists of those applications to see if it is a possibility. There are some limit in using those applications. It has to be, it's like the face cover, it's going to be complementary, because what the gold standard is still test, and doing the investigation and isolating the cases, but it may be something that we see as a complementary measure to have the population being a partner with us in contact tracing. But there are also some limits and some issues of privacy and confidentiality around those applications, but we know they are available, and we're analyzing the situation. So next week we'll see, and of course with the government, if it's something that could be interesting in an urban context where we have high density and sometimes difficulty having to do contact tracing.
Well, is it likely that it will be introduced?
I have to have the presentation on the application that are available right now, so it's something that we're looking at.
We wish just that it fits the needs of public health and respect also the issues of confidentiality. I think that's and it's true that if we want it to be okay and give us a plus value, it needs to be obtained by a lot of persons. So, and as probably it won't be mandatory because of different issues. No. It's not everybody who get a phone, or even in those hotspots where there is vulnerable people, they don't have the technology for this necessarily. Because it will not be, the only way would be to go do a lot of promotion of the use, and that the person must understand that it's beneficial for her or to others. So, but we are looking at all that thing. It's a work which is done in province by province, but also with the federal government.
Prochaine question.
Alicia Rubertucci, City News Montreal. Dr. Arruda and Premier Legault, with the news of the youngest death in Quebec due to COVID-19, a 27-year-old woman, and crunching some of the numbers, more than 40,000 cases, how alarming is this for you, and how likely is Montreal going to be deconfined?
Well, first of all, and I will let probably, I don't know if the Premier, I think I will answer, and Dr. Mylène Drouin, which is in Montreal, she's the best to answer to that question. But in fact, as I told, the situation is not controlled enough to us to open schools and deconfine Montreal in a big way. We are seeing a tendency to deaths going down, less intensive care use, but we are in a very fragile situation. As I told, we had prevented a lot of cases by the big limitations, because our health system was not overwhelmed at the beginning. Now we are coming back to some activities. There is a need to make sure that we have the capacity before making the confinement. But also, I want to say, but there is hotspots. There is probably, I would say, transmission that we are looking at with that test strategy of cases and contact, investigation and control, for not those outbreaks become everywhere. So, and if we do reopen, we will need to be in a better position. Actually, I would consider that we are not in the intensive care, but we are in a very, we call it soins intermédiaires, where any movement, it's a fragile situation. If everybody get away, get out, don't comply to public health recommendations, if we call you and say to you, you're a case, your family must have tests, if they are positive, they must stay at home, or if they are not, they must stay at home. If you don't do that, that will be introducing the virus elsewhere in a more intensive way. I will let now Dr. Drouin answer other questions.
I'll just complete because I think it is quite the explanation, but I would complete by saying that now that we have community transmit, what we've seen was high rates of deaths in CHSLD, and the principal factor is that we were with elders and really fragile person. Now that we are having community transmission in some neighborhoods, what we have to be aware of is that we see younger people contracting the virus, and we see that we have some younger people who are vulnerable also with chronic diseases, and those people have to be more vigilant also in the way they protect themselves, and they protect themselves because they're more vulnerable to have high consequences if they have the COVID-19. And that is what we're seeing, that some of the cases that we have in community transmission and the cases that we're seeing in our hospitals are people that do have sometimes comorbidity. And this is a message that we have to send to younger people. If you are in a vulnerable group, you also have to be more careful, like elders.
On va prendre la prochaine question.
Yes, hi. Jason Magder with the Montreal Gazette. The situation in Laval, can you hear me okay? Yeah, the situation in Laval is very worrisome. About half of all the healthcare workers so far have tested positive for the virus. There's employees, the employees who are left are also going to CHSLDs that are in the private system, and as well as seniors residents in the private system. So they're being spread very thin. How are you going to help out the employees in Laval, in the CIS de Laval, who seem to be spread very thin and are not able to handle it?
Yes, we've met with the PDG of the CIS Laval yesterday, and it's true to say that it's been difficult in Laval since many weeks. But he tells us that the situation is starting to stabilize. Of course, when we say that, it's still difficult. He also mentioned that he's very appreciative because hundreds of people he's been able to hire on Je Contribue, which is very, very helpful. And he's also opening a new site, the Bell Center there, to have some patients go there, and he has the staff to do it, which is a good news. He's also helping a lot some private facilities, as you mentioned, I think. So I think it's starting to stabilize, but it's still difficult, and it has been difficult since the beginning, but there's a bit of light at the end of the tunnel.
Prochaine question. On va prendre la prochaine question.
Okay.
Rob Lurie, CTV News. I'm going to, given Mr. Legault, that you were cautiously optimistic about the numbers today, which show fewer than 700 infected and the death rate the lowest since mid-April. When will parents hear an answer about summer camps, day camps, and sleepaway camps? Will the children be able to go there this summer?
We'll be able to give a date when the situation will be under control, which is not the case. I'm happy about the trend, but we're not there. So as soon, and I hope it'll be in the next few weeks, that we'll be able to announce what will happen with summer camps. I hope they'll be open, but I cannot tell you today a date, unfortunately.
On va prendre la prochaine question. Oui.
Yes, good afternoon. My name is Wei Yang from the Epoch Times newspaper, Global Media. I work for the Chinese section. Here are two questions from our readers. Sorry, I had to read two. First one is, scientists says screening capacity is important for further control of the pandemic. Mr. Legault, you said in previous conferences that Quebec has one of the most screening capacity in the world. And there's some graphs showing on some other media saying that it shows that Quebec or Canada is in a low level. How do you, explain a little bit of measure? We tried to, can explain to the reader, please?
Okay, it's clear that when you look at the number of tests per 1 million people, Quebec is one of the places in the world where we have the most tests. To give you an example, the city of New York, they've put some numbers, some targets before reopening, and we already meet this target about tests, the number of tests per million of people or per 100,000 people. We would be meeting the target of New York to reopen. So I think that for the tests, of course, we would like and we will work very hard to still increase the number of tests. But right now, we're one of the places where we test the most. We test more than in the United States, more than in France, more than most of the places in the world. Mm-hmm. And now we are now the first province also. Before, Alberta was testing more than us per 1 million people. We're testing a lot more so far, cumulatively, than Ontario. So, but it's not enough. We want to test more, and especially in some boroughs.
Mm-hmm. Thank you. Second
we'll
question.
Take the last one. Yeah, go ahead.
Thank you. We understand that Quebec government would like to unlock the confinement. We know that also in some places they do not implement confinement at all, for example, Sweden and Taiwan. So the community would like to know that how you can apply some experiences or we learn from those areas. Thank you.
Yeah, but I think that the criteria are the same everywhere in the world. And if we want to be successful, we have to copy what successful countries did. And right now, the main criteria that we don't meet in Montreal is the number of beds, including the employees, that are available. And until we have that, we won't be able to reopen more.
Merci. C'est fini.
Merci tout le monde.
Thank you, everyone. Have a good weekend.